Kasey here from My Health, My Happiness. Today I'm very lucky to have some time with the inspiring Dr. Sherrill Sellman. So thank you for your time today, Sherrill. She's doing her Adelaide talk here tonight. Now, to briefly introduce Sherrill, she's a renowned women's health expert, and she's brought us two best-selling books, What Women Must Know About Their Hormones and What Women Must Know to Protect Their Daughters from Breast Cancer. Now, so welcome to Adelaide, Sherrill, and to my naturopathic clinic, Aloe Health.
Thank you. It's a pleasure to be here.
Now, today I would love to expose the myths behind synthetic hormone use. So I've got many patients that come in, whether they're young women on the pill or women going through menopause on hormone replacement therapy, and they're actually very oblivious to the side effects that these have on their body. So can you touch on what the pill and HRT do and the side effects that they may have?
Absolutely. We need to talk about that because doctors are not providing this kind of information at all. In fact, they don't really tell women much, nor do they assess them and guide them to see if they are even appropriate to be on the pill. So let's look at some of the facts. So the pill is made up of synthetic estrogens and progestins. So is HRT. And the first thing that people need to know is that these are known human carcinogens, which is a pretty shocking statement. You know, I mean, I was appalled when I discovered they actually are considered known human carcinogens. There's a whole big book that comes out every several years in the United States of known human carcinogens, potential human carcinogens, and estrogens and progestins are known human carcinogens. So, you know, what that means is that they're carcinogenic. They can cause cancer. And that is, I guess, one of the greatest concerns women need to know, that these are not just natural, benign substances that we're putting into our body. They actually can increase the risk of things like breast cancer, which is very sensitive to high levels of estrogens and progestins. So breast cancer, perhaps uterine cancer. The estrogen fuels so many different cancers, but it's probably breast cancer that becomes a big risk. So that's one thing we need to understand. The other thing we need to understand is that these drugs actually cause major depletion of key nutrients in the body. So, for instance, they deplete the body of vitamin E, vitamin C, B6, folic acid, B12, magnesium, zinc, selenium, vitamin K. They can deplete tyrosine for the thyroid. So when you have major depletion of these key nutrients, you are at greater risk of cardiovascular disease, of infertility. You're at greater risk of strokes, of blood clots. You can have depression, low libido. The pill and HRT, the estrogens, can alter your blood sugar levels and can be more conducive to the growth of candida. So you have candida overgrowth going on in these women. It can impair your moods, can make you depressed, make you anxious. You know, the consequences could be long-term. In fact, one of the warnings I like to give to women is that, based in my book, in Hormone Heresy, I actually wrote about a fertility expert. He's a billionaire. He makes fertility drugs, and he said his best customers are women in their 30s who took the pill as teenagers and 20-year-olds because the pill can seriously compromise a woman's fertility for the long term. And we do have problems with infertility in this country. It's a huge problem.
Definitely.
So, you know, that's kind of it for starters. And I'll say one other thing, because based on genomic testing, which I know you were doing, Kasey, we see that the liver, most people have impaired functioning of their liver. Our liver just really is not capable of keeping up with the demands of the 80,000 or so chemicals in the environment. And the hormones in the pill and HRT are considered chemicals, and they all have to be metabolized by the liver to be safely taken out. If you have a liver that is overworked and isn't functioning properly, you actually can turn these chemicals, these hormones, into more potent forms of the estrogens, for instance. And it can be another risk factor for high estrogen levels in the body, breast cancer, again, fluid, weight gain, depression. So we really need to understand that if you choose to go on these drugs, we need to support the body with good nutrition, and personally stay on them for, well, I'm not a big fan of the pill. I'm not a big fan of HRT because for most women, they're put on the pill not primarily for contraceptive purposes, but primarily to help with acne, heavy periods, lack of periods, painful periods, endometriosis, ovarian cysts, or just to eliminate the messiness of menstrual cycles, all of which we can address with more natural approaches. So the pill doesn't heal the body, it just takes our ovaries offline.
And these are all conditions that I see so common in clinic, PCOS, endometriosis, and really chronic menopausal symptoms. So what other contributing factors, apart from the synthetic hormones, cause these conditions?
Well, polycystic ovarian syndrome is really considered a pre-diabetic condition. So we know that whenever I work with women who have polycystic ovarian syndrome, I ask them one question: do you have sugar cravings? And they all admit they have sugar cravings, because sugar actually is a major contributing factor to impairing the functioning of the ovaries. Because polycystic ovarian syndrome means that the ovaries, they're not doing what they should naturally be doing, which is maturing follicles, which are the sacs the eggs are held in, and one usually matures, and that's when we ovulate, and the others after that will dissipate. But if you're not in hormonal balance, if your hormones are out of whack, if you have too much estrogen, if there are a variety of things going on, nutritional deficiencies, stress, then these cycles, which are highly sensitive to all these things, are impaired. So now you have all these little follicles, instead of dissolving, they're just all hanging around and cluttering up the ovary, so to speak. So the ovary doesn't really function properly. You don't really ovulate, you don't really release an egg. And it's all fueled by sugar, which alters hormones, creates high testosterone levels. People with polycystic ovarian syndrome have these male-like, hormone-like conditions. They can have more acne, more facial hair, they can have hair loss. Of course, infertility is an issue because their hormones are not in balance again. And I really think that our society that is just addicted to sugar and carbs, which turn into sugar, raise our insulin levels, are really driving this condition. This is another condition that is really a product of our cultural way of eating, which is high carb, high sugar, and low nutrient status. So that's polycystic ovarian syndrome. Endometriosis is really a chronic inflammation of the uterus, of tissue from the uterus that is moving outside the uterus and attaching and adhering. Very painful condition, kind of responds to the monthly surge of hormones, but can cause a lot of pain. It can cause a lot of scar tissue and adherence, which often leads to more radical surgeries. Again, it's toxicity, it's stress, and it's chronic inflammation. And what drives inflammation? Sugar, poor nutritional status.
Omega-6s?
Yeah, a lack of proper, too much of omega-6, not enough omega-3. So our nutritional status is all out of whack again. And, you combine that with lack of sleep, the stressful lifestyle. Definitely the toxicity of our environment drives this as well, because then it starts impairing other functions like the thyroid. So we have to start healing at the root cause level, which is all part of these extreme menopausal symptoms. Women have never been taught that menopause should be a non-event. We should just breeze through it if we were healthy and in balance. And to the degree we are not, be it polycystic ovarian syndrome, endometriosis, menopausal symptoms, or any other of the many categories of hormonal imbalances that show up, they're all signs that our body is seriously out of balance, seriously toxic, seriously inflamed, seriously deficient of key nutrients, suffering from side effects from other medications, a variety of things, and we have to go back and heal the body at the root cause level.
That's right.
And we need to understand that those symptoms are not normal. It's not normal to have a severe menopause. It is a symptom, just like, an ache in your joint. It's a symptom, and we need to pay attention and to take action and get committed to our health.
Tune into the body as well. Yeah.